Can you tell us how to help kids with mental health concerns?
Another cool thing that the Common View Community Collaborative is working on with all 3 schools is working with mental health concerns of middle schoolers. So in the old days, our only tool might have been to hook that student up with the school counselor or a provider that comes into the school building for mental health services. And of course, those things are occurring. But also what it means is digging a little deeper into those concerns that all middle schoolers have and trying to integrate that learning into the classroom setting. So for example, the students that are participating in Common View took an assessment early on in their school career where we asked questions about the things that are concerning to them. And then those topics are the things that are brought into the school curriculum to reinforce that learning on improving their mental health. That includes their relationships with their parents, their relationships with their peers, how to self-regulate, all those kinds of things that we all struggled with in middle school. All schools have access to a school nurse, one way or the other. One thing that the Common View Collaborative is doing is looking at the reasons for the school nurse visit. So some schools have a whole lot of stomachache visits. Probably those kids really don't have a stomachache. That really might be a manifestation of something going on at home or in a classroom with another student. So one of the things that the collaborative partners are doing is really digging down into what's going on in those students' minds when they come in for the stomachache complaint. And again, as they're learning about what's happening in those kids' lives, they can create programs that all kids in the building can take part in that address those struggles. One specific activity that's being done is working with yoga in the classroom. Now we might consider that being really out there, kind of crazy, but in fact it's a very common and very useful method to help students self-regulate throughout the school day. What that means is we might be taking a brain break before a test or after a test. It might mean we've spent some time in mindfulness, 2 or 3 minutes in the classroom. And what it also means, though, is that the teachers have that additional tool in their toolbox. So for example, maybe this particular teacher has a hard time getting the students who are coming straight from lunch settled down and ready to go. Maybe those kids saw something in the hallway that was upsetting, or maybe there was news that just came out that was upsetting to the students. So the teacher also has that brief time where they spend together in a very simple way in mindfulness to add to their own tool to help their classroom get through the day. Now indeed, those teachers are still able to send the students to counseling that's needed and so on, but the teacher has added to his or her own repertoire of skills in the classroom this ability to help the kids before they leave.